Imagine your child is playing in the yard and suddenly you hear a loud scream for pain and fear both together. Snake bite, a really serious concern for everyone. Approximately 5.4 million snakebite incidents occur worldwide annually, resulting in 125,000 deaths. Means one death in every 4 minutes. So we are facing one of the most deadliest animals in the entire world. But here is the good news. Most deaths are preventable with the right actions. Today we will walk through exactly what to do and what never to do if this happened to any child. The first and primary action is to pull your child away from the snake and move to somewhere safe and never ever try to capture the snake. It may worsen the condition if the snake bites you and your child once more. Call for an ambulance soon. The antivenom works best in the first 4 hours of the bite, so any delay in calling for help may lead to irreversible consequences. The next thing we are gonna do is to prevent excessive movement and keep the child still, because movement spreads the venom faster in the body. So try to have the child lie down in a way that the bite site is below the level of the heart. At the next step, wash the bite site gently with soap and water. Then use a dry bandage, but never wrap the bandage tightly around. Write down the snake's color and size, bite time, and circle the swelling progression with a marker. If you cannot write it down, have it in your mind. These data are really useful because they can help identify the type of snake, which is critical in snakebite management, especially in regions where specific venom effects are significant. After having all these steps done, here is the more important step to learn. That is avoiding common mistakes and what not to do in this situation. Many people believe that tying a snake bite with a tourniquet or elastic band helps prevent the venom from spreading throughout the body. But this is deadly wrong for two important reasons. First is cutting off the lymph blood flow for a while. That can lead to lymph loss, and also when we lose a tourniquet, a large volume of toxin and toxic blood is released through the body that can be fatal. The next important not to do part is to avoid sucking the bite side. This is definitely dangerous and ineffective, because snake venom enters the bloodstream or lymphatic system within minutes, so the time you attempt to suck it out is already beyond the bite site. And also human's mouth contains various types of microbes, so sucking the wound can introduce new bacteria, and this leads to probably wound infection, cellulitis, or abscess formation. Another wrong belief about a snake bite is cold compress or putting ice bag on the bite site. This is definitely wrong and dangerous because it deepens the tissue damage. The next thing we are gonna avoid is not giving food and water, especially drinks contain caffeine and alcohol, and also painkiller medications, especially NSAIDs, because they increase the risk of bleeding and spread the snake toxin.